For most patients, they should consider wisdom teeth removal around the age of 60. And simply that's because when you have the maximum benefit and minimum risk. As you age, risk increase with wisdom teeth removal. What risk am I talking about? Well, there's a nerve that goes through your lower jaw and it gives you sensation to your lip and chin. As you age, your wisdom teeth get longer and longer, and they're at greater risk of wrapping around the nerve. So if you wait until you have pain to take out the wisdom teeth, um, there's an increased risk of injuring that nerve and causing permanent numbness. And I don't want that for my patient. So I think proactive evaluation is favorable for most people. Other risks associated with wisdom teeth removal include jaw fracture. So as you age, your bone gets denser, and therefore when we remove the wisdom teeth, the bone is less malleable and you're at greater risk of fracture. You also tend to have more postoperative swelling and discomfort when you're older, when you get the wisdom teeth out. And the other big problem with waiting too long to get your wisdom teeth out is that you may have irreversible damage that occurs, right? Because impacted wisdom teeth can contribute to bone loss, cavities, and rarely, but possible, you can also have cysts and tumors that develop around the wisdom tooth, and that becomes a lot more complex in terms of treatment. Although wisdom teeth may not be painful, there are times that they still need to be removed. Most commonly, when your dentist takes an x-ray, they may see signs of bone loss or cavities that would then prompt wisdom teeth removal. For most patients, I typically recommend all four wisdom teeth to be taken out rather than staggered, because after your wisdom teeth are removed, you will have to go through a period of discomfort. You're going to have to go through a period where you need to be on soft diet and to exercise meticulous hygiene to ensure you heal well. So rather than going through this process twice, I often recommend taking out all four teeth so that you only need to go through it once. I particularly recommend all four being taken out when patients decide to go to sleep because, you know, anesthesia always carries risk with it, and the fewer times you go to sleep, the better. So I recommend all my patients who go to sleep to have all four taken out. Taking out all four wisdom teeth typically takes about anywhere between 30 to 45 minutes, depending on the complexity of the case. Sometimes it can be a little quicker, sometimes it can be a little longer, but most cases range anywhere between 30 to 45 minutes. For most of my patients who get their wisdom teeth removed, particularly my anxious patients, I will often recommend them to go to sleep for the procedure to ensure their comfort, but also their safety, right? What I tell my patients is, look, when we take out your teeth, I can give you an injection that will remove sharp pain, but it doesn't remove all sensation. You unfortunately will still feel pressure. You will hear the sounds associated with the procedure. And what's most difficult for patients is because we're working far back in their mouth, they often will have a strong gag reflex. Those sensations, unfortunately, I can't blunt with local anesthesia. Really, the best way to keep them comfortable is to sedate them. It'll allow me to make sure that they're comfortable and that I can do my procedure without really the stress within myself that I'm causing them discomfort, but also it allows me to focus on the procedure, right? Because my energy and focus is finite, right? Is what I tell my patients. If I'm spending energy and focus on making sure you're comfortable, it takes away from my ability to focus on the surgery. So when I know my patients are asleep and comfortable, it really allows me to devote all my focus and energy on your surgery. One of the recent advancements in wisdom teeth removal is the utilization of PRF. PRF is an autologous blood product that is filled with growth factors. So what we do is at the start of every wisdom tooth removal, we will draw a small amount of your blood, and while I'm doing your surgery, the blood will be spinning down in a centrifuge. Once the blood product is finished spinning, I remove the small clot, I place it into your extraction sites and help sew it up. And what I've found is that it's been really beneficial for my patient's recovery. It virtually eliminates the risk of a dry socket, and it helps speed up their healing, which also means they need less post-op pain medication. The swelling time decreases, and it has just made my patients a lot happier.